Hello, everyone, and welcome to the SocaMom Summit. I know you are looking forward to this update. When we were here last, just 2.5 months ago, almost 3 months, we had 91,000 cases of COVID-19 worldwide. At this point, we have nearly 2 million in the United States alone. So this update is really important. We have some new developments. We also have a protest, a global protest that has been happening with all of this going on. So we have a lot of great information for you. We're going to get right into it. Dr. Renee is going to be leading this discussion. Thank you, Dr. Renee.
Hi, everyone. I am Dr. Renee, and I'm so excited to bring you back this update because, dear God, things have changed. And so we need to know what's going on now. So we're going to bring that to you. I am here with Dr. Randi and Dr. Kelly. Hi.
Hi.
So let's get started right away. So we have 2-point-something million cases in the U.S. alone. So Dr. Randi is a pediatrician who has been working on the front lines this whole time. And then Dr. Kelly is an endocrinologist who has also been working on the front lines this whole time. So first of all, we found out after we did the last one that there was 3 underlying conditions that were causing deaths in the Black community: diabetes, obesity, and heart disease. And of course, Dr. Kelly, you obviously had to deal with that. So can you please shed a little bit of light on how that impacted, why it impacted? Because honestly, the numbers of Black people, like I said, I don't remember the date we did this, but my God, the numbers just shot up all of a sudden. It was a whole lot of Black people when everyone was trying to say we couldn't get it, right?
Yeah. So initially when this pandemic started, there was a little joke going around that it was not affecting Black people. And then maybe 4 to 6 weeks into it, we realized that no, African-American population was actually being disproportionately affected by COVID-19. There were some numbers coming out of Chicago where you're at, Dr. Renee, that showed that even though the Black people was about 30% of the population in Chicago, in terms of the cases, we were 70% of the cases. And why is that the case? And we found that, we had, as a community, had more of those underlying comorbidities like hypertension, diabetes, heart disease, and obesity. And as an endocrinologist, I see patients who have diabetes, and my patients were calling, really concerned. I've written so many letters for patients to stay home. And I just want to make the point that having diabetes does not increase your risk of getting coronavirus. But if you do get it, having diabetes increases your risk of having a severe complication or even death from it. So I've been, really asking my patients to keep their blood sugars under control, keep checking their numbers, even though we are sheltering at home and not moving as much and just sitting in front of TV eating, that we should still be mindful about our diet. If we can get out to go walking, if we have access to, a treadmill or a stationary bike, or even turning on the television or YouTube and dancing to something, just staying active will be helpful in keeping those blood sugars down and reducing your risk of having a serious complication.
So Dr. Randi, back when we were on before, it was old people. No Black people and old people, no young people. So now the tables have quite turned. We've unfortunately had deaths in children even. So yes, children have gotten COVID and we've had deaths. So can you please speak to that and maybe give us some of the numbers? Because it is shocking how we went from saying it was only people 60 and over.
I know. So, I've always said that children can get COVID, can get the coronavirus. Initially, they may show very mild symptoms, runny nose, cough. Initially, children were not being hospitalized. But then as the weeks started to move forward, we noticed that a lot of young people, a great number, like 29% of young people between the ages of like 20 to like 40, it's like young adult to like middle age, were being hospitalized. And what has developed since March, we've seen it like usually, like by May, we started seeing something called the multi-system inflammatory syndrome / children. And this is a complication that it's very similar to what we call, it's very similar to a disease called Kawasaki's disease, which is vasculitis, which is an inflammation of blood vessels, very similar to this disease that, you know, I've seen a couple of times. I wouldn't say that it's super, super rare, but I've seen it as a resident. I've seen it as an attending. But this disease, this MIS-C, is a much more severe presentation. It's not, they don't call it Kawasaki's in this population. They call it this MIS-C, and it is much more severe. I mean, we have children in New York State. Up to 2 or 3 weeks ago, we had 147 kids with this, with a number of deaths. I think about 3 or 4 deaths. And the children they get really sick. Really, it's much more severe. They initially start off with like GI symptoms, diarrhea, vomiting, but then they can start showing signs of cardiac complications or cardiac injury. One of the complications of Kawasaki's is coronary aneurysm, and they're seeing the same thing, but this is a much sicker presentation than Kawasaki's. So that's what we've seen in the past couple of weeks, which is, you know, really frightening. I know my parents, when I, you know, do my telemedicine and when I do my calls, like if their child has a fever, that's the first thing that pops up. And, you know, and even as a physician, I tell them, I'm like, look, we have to be very careful with this because it can progress pretty quickly. And, you know, the minute you see, certain signs and symptoms, you have to present to the hospital. You have to take them in. So yeah, that's one of the more scary, as a pediatrician, this is something that I've had a heightened awareness of.
So we have had some civil unrest, if you want to call it that, but we've had some protesting, rightfully protesting, but protesting going on in the country. And of course, the protesting came on the cusp of several states opening up. Unfortunately, not sure that they should have definitely been out there protesting. I heard today that members of the National Guard are now COVID-19 positive. Hopefully they will be fine. If they do get sick, they'll be fine. But I know, Dr. Randi, you were out there protesting. Can you speak? Hopefully your protest, I know I have some people that protested, but it was social distancing protests, and they literally were spread out. They had given them masks. They gave them hand sanitizer. So can you speak to the protest that you attended?
Right. Yeah. So I know this is like a controversial thing, but, you know, we did have that awful, I'm going to call it murder, homicide, yeah, of George Floyd a little over 2 weeks ago. So, and for some reason, like, this has really sparked significant protests around the world, not just in the United States, but around the world. So, you know, it's tough because we are still in the midst of this pandemic, but, you know, as a Black pediatrician, as a Black woman, as a sister to a Black male, and, you know, Black boy, you know, having a Black boyfriend, this, to me, this pandemic, this public health emergency of unarmed, Black men and women being killed is very important to me, almost as important as COVID, in my opinion. So I felt it was important to protest. But what I've seen, I've participated in 2 protests. I did one on Long Island where it was moderate. You were able to social distance. And I saw the vast majority of participants with masks. Organizers were giving out hand sanitizers and masks, and encouraging people to kind of keep their distance. This was I participated in this one about a week ago. Last Saturday, I participated in a very large protest in New York City, and thousands of people were in this protest. And I would say that the vast majority of people, again, were wearing masks. Obviously, social distancing was a little bit, depending on where you were in the march, you were able to keep distance. But there were some times when we were, pretty close. But again, organizers were encouraging hand sanitizer. They had like trucks, they had trucks along the route where, you can, they were literally squirting hand sanitizer into your hands, and they were giving out masks. So organizers are being extra careful with this. I was in Washington, D.C. Yesterday at the Black Lives Matter Plaza, and there were groups of people who were giving packages. I wish I had brought it here. I meant to bring it here so you could see it, but it had like snacks, it had water. My package had 2 masks, it had hand sanitizer, and this was free. They were giving it to everyone in the plaza. So we, from what I've seen, people are really trying to be careful while being socially conscious and participating in the right to protest these killings. So we're not going to know how it's going to affect us probably for another week or two.
Right.
So yeah, there's a chance that we may see a spike, but I'm hoping that people are careful. I would not recommend older individuals going out there to march. It was mostly young people. What they did in LA last weekend, they had a caravan of cars. So for people, for individuals who could not walk like the 10 miles or could not, or were concerned about socially distancing, they protested in a caravan of cars, which I thought was a great, great idea. Like you're able to do whatever you want by participating that way. So it's something we'll see what happens in the next couple of weeks. We'll definitely see how the numbers will look. I'm hoping it's not too devastating because both are very important to me.
Right. So actually Chicago's protest the peaceful protest that started out that first Saturday was peaceful, and it was in cars. And I saw cars, people had masks on. I was like, this is great. Yes. And by that night, it was, looting, and it was a whole lot of people not wearing masks, unfortunately. So, and I know, Dr. Kelly, you participated as well, and yours was a social distancing one as well, right?
Yes, it was a much smaller, protest in suburb of Atlanta. I live in Smyrna, and it was like on a grounds of a park. So we had enough space that we could definitely, if you didn't come with someone or weren't in a family, you could definitely do the 6 feet social distancing. And the organizers, even before you got there, they said you must wear your mask. So everyone that was there had on a mask. But, we are already seeing a spike. Even before these protests started, we were seeing a spike because of the reopening of different cities, and even people who were celebrating Memorial Day. That led to a spike. And I recently flew to Miami to see family, and it was my first time traveling, getting on a plane since this all happened. And it was quite an interesting experience. ATL is the busiest airport in the world, and it was not busy at all. Wearing a mask was mandatory on getting on a plane. I went on Delta. They didn't, sell the middle seat. So life is not the same. People are still wearing masks, but I'm still not seeing it enough. Whenever I go into a public place, I wear a mask. The mask does give me a little bit of protection, but it's really to protect other people from you. So we all need to assume that we are COVID positive, and wearing a mask will help to protect other people that are around us. So when I see someone walking going into a store, going into the grocery store, or even in the airport or wherever, and they're not wearing a mask, to me, I think that's selfish. Unless you have like a medical condition that prevents you from having that mask on, I think it's imperative that we try to take care of each other by putting on a mask.
I totally agree. I agree. And unfortunately, that has been, a problem. I, of course, haven't left my house in 10 weeks, but I wear my mask, when I have to go to places in my building, and it blows me away when I see someone without it. And there was a maintenance man that actually came up COVID positive, and I really wanted to know, was it the one I saw that wasn't wearing a mask in the hallway? Because I was going to do my laundry and I saw him and he was getting on and off the elevator. I also noticed now there's a sign in our elevator that says only 2 people are allowed.
Yeah.
Which I'm glad about that too.
Even in my office, there's some patients who come in without a mask.
No, that's crazy.
So we have a sign up saying you cannot be seen unless you have a mask on, and
we supply masks. We supply masks to the patients, which is good.
Mm-hmm.
Yeah.
But I find that you can feel that the fear and the anxiety that we had at the beginning is kind of easing a little bit.
Yeah.
So we're beginning to live with COVID-19, but that means that we're relaxing some of our precautions, which is dangerous.
Yeah, we cannot relax the precautions. You guys, we have to, if you notice, what we did worked. Once we all were in place, the numbers came down. So if we wanted to continue like that, we have to keep doing this. And actually, the CDC put out information now that the cloth masks are okay. So yes, granted, PPE is still a very hard item to get. I know lots of doctors that are still struggling to get their personal protective equipment so that they have the correct mask that they need to see their patients, whether it be in the hospital or in their offices. And I really, really, really want everyone, I encourage you to please wear some form of a mask, whether it be a cloth mask or a surgical mask, or if you're blessed to have an N95 and N95 mask. But we also want to remind you to take your mask off if you're in the car. If you're in the car, take the mask off. Just a FYI. But we want to talk about after we do finally have this new normal. A lot of parents are concerned about school, Dr. Randi. What do we say about that?
Yeah, it's really, I'm in New York City, which was the epicenter of this whole coronavirus here in the United States. So just to talk about how effective the social distancing and the mask wearing is, how effective that was this past weekend, Governor Cuomo said that we had 35 deaths in the entire state, okay? Considering we were having 700 deaths a day at the height of the pandemic in New York City. So it works. And in terms of the school, it's tough because I know in certain states, in certain areas, places are open up in phases. Here in New York, we are just entering, New York City just entered phase 1 this week. Long Island, where I live, we entered phase 2. And there's still, I know we're being very cautious in terms of school openings, camps. From the last time I understand, there's still a lot of camps that are contemplating whether they're going to open or not. I did hear about some that said that they were going to open. I think they were further like in the Midwest or so. And, for parents, it's really, it's a tough thing because the summertime, especially if parents have to go back to work, the summertime there's no school. You can't, some parents you can't leave your kids home by themselves to their own devices. You just can't. And it's a great time for parents to send their kids away and they can socialize with other kids and develop new skills. And so parents really look forward to this. So, but what I suggest, and I tell, some of my parents who are, because it is June, school's going to be out in the next couple, officially out in the next couple of weeks, use your judgment. See what kind of precautions the camp is doing. See what they're doing in terms of sanitation, in terms of the amount of kids that are going to be on, participated in the camp. A lot of things have to be at a reduced volume so that you can ensure that there can be social distancing, that, kids are not on top of each other. Maybe parents want to stick to day camps and not so much sleepaway camps, because, they'll be in this environment for, a certain amount of hours, say 8 or 9 hours, and then they could come home in the evening. So just see what measures the camp is doing. If you do not feel comfortable with what the camp is doing, then obviously do not. In terms of school, same thing. We really got to see what's happening. We got to see what the districts are planning to do in terms of classroom size. These are things you got to think about, especially like in a place like New York City, where you may have 30, 40 kids in a class. That's going to have to change. So be very careful. Stay on top of what your school, what your camp is doing. And hopefully they are taking the correct measures to keep your child safe. And if you just do not feel comfortable, try and find some other, other way to entertain your child in the summertime.
Yeah, there's virtual camps that you can do on the computer. Right. So obviously, because there are some parents who either are permanently now going to be at home because of their job saying you can work from home, or they're still going to be at home because of COVID-19 because their job said so, or unfortunately they've lost their job. So, so this summer you can do virtual camps. And then in the fall, I've heard a lot of parents talking about doing co-ops with homeschooling. So perhaps a group of parents get together and they hire an English teacher, a Spanish teacher, a history teacher, whatever. And they have a co-op where it's a small group of children, but they've paid a teacher to come in and teach their children, because let's face it, we are not all teachers. That is not what all of us
Yes, exactly.
I sign up for the fact that I'm not one.
And a lot of parents found out the hard way.
Unfortunately. But you ladies, I want to spin this really quickly because we're running out of time, but I want to make certain we cover the islands. So I want to say, one, kudos to the islands because they handled this far better than the United States did. Yes, oh my God, so much better. And then my next thing is girls run the world, because in Barbados you have a lady and she ran it like a tight ship, and that is why they had minimal cases. It didn't take out the whole island. Australia, go ahead, what?
Which it could have easily.
It could have easily. Australia had less than 100 cases.
Wow.
The entire country. That's a problem to me, that we have almost 2 million and Australia had less than 100. So the islands, kudos to them. Now we know as of today, most of the islands are still shut down. I do know my lovely island of Antigua has decided to open up. I'm not sure that was the wisest thing, but they had flights from Miami, no doubt, which, like I said, I'm not sure that was the wisest thing starting last week, I think. They had flights from Miami, and I'm like, oh boy. But they did start flying from Miami to Antigua, and then they said, I guess in the coming weeks they'll be flying from New York to Antigua. Wow. Which I still think, like I said, I think it's too soon. But I know Barbados, they handled it. If you were to fly into Barbados right now, you have to be quarantined for 14 days. In an undisclosed location, because they are not playing. They don't want anybody to come get you. It is a secret, and you will sit there, and then you can go about your business. And I think that's smart. That makes perfect sense.
Yeah. And it's going to deter people from even visiting, because who has over 2 weeks to quarantine on vacation? I know I don't, unless you're retired or something.
Yeah. So my family's, I'm from Barbados. My family's there, and I would love to go to see them. But like you said, Dr. Randi, I don't have 4 weeks to go spend 2 weeks in the park and then 2 weeks to see my family. But also what they're doing, because they had a repatriation flight from New York and Miami back to Barbados yesterday. As soon as the passengers touched down in Barbados, they all got a COVID-19 test. And I heard it did detect some people who were COVID positive. So perhaps they might need to do that test before they even get on the plane. But I'm sure, as things progress, they're going to tweak their protocols. But over the last 2.5 months, they have been very strict for about maybe 3 to 4 weeks, they were on 24-hour lockdown where you could only leave your home if you were going to the grocery store. And the grocery store, you went according to the name of where your name fell in the alphabet. So they were very organized. If you were caught not going to the grocery store or not going to for medication from the pharmacy, you could possibly be arrested and fined. You could not even walk around your neighborhood. So they were extremely strict. And when it came to reopening, they did it in a very stepwise manner. The first thing that happened was they said, you know what, you can go to the beach just for 3 hours between 6 and 9 in the morning. And then as a couple of weeks went by, they said, okay, you can go to the beach twice a day now, in the morning and in the evening. And they said, okay, you can restart non-contact sports now. So I think the Prime Minister Motley did a really good job at, keeping a handle on the pandemic in Barbados.
Yes, I totally agree. And then even in Antigua, there was minimal cases, but I still feel like we're just a little bit, and honestly, we did not test as many people in Antigua either, which is the other thing that concerns us, because for that contact tracing, you have to test a lot of people. And if you don't test a lot of people, then what are we doing? And so apparently the protocol for Antigua is the people flying in have their temperatures checked. But
not everybody has temperature.
I was just about to say, I have a very close family member. Dr. Kelly's very aware. And so is SocaMom Eva. They don't have a temperature and never have, but have tested positive twice.
Yeah, twice.
But never had anybody's symptoms. No temperature, shortness, nothing.
Asymptomatic carrier.
Asymptomatic carrier. So easily could go into a room and, take out a whole room, but has it. So you got to be careful. And that's why I'm just very nervous. I don't want anything to happen to any of our beautiful islands or, our families there. But I know for a fact, because even here in Chicago, we have to reopen just for the economy's sake. We get it. We just want everyone to be healthy and be available next year when we don't have to worry about this. And next year because obviously I think all three of us come from islands that are not having carnivals this year. So next year we want to be able to jump up. Yeah. And we want to be alive to jump up. I'm just saying, I had a lot of intentions of getting to Antigua's Carnival this year, and I'm not going to make it. Now, God willing, I'm still going to Antigua this year a couple times, but it will be in the latter part of the year. And the fourth quarter is when I will probably emerge back again into life. But for now, I am just fine. I never thought I'd be just fine for 10 weeks, but I am just fine and could do another 4 without a blink. But thank you, ladies. Please, first, Dr. Randi, tell us what you are doing, what you have coming. I know here at the summit, you're doing something for all the wonderful people. And before you say that, Dr. Randi and I did a fabulous video to tell you how to get your COVID money. And you guys, when I tell you, she knows what she's talking about, because guess who applied for her PPP. So I'm really excited because I think it's coming. And I had already collected some money before that. So you guys, please, you need to watch this video. But Dr. Randi, please tell them, because she's once you get that money, then you really need Dr. Randi.
So for the summit on Sunday, June 14th, between noon and 1:30, I will be hosting a workshop on how to make that leap to your next career. This is fresh off my Humans of New York feature, where I talked about my career change from investment banking vice president to pediatrician. So that is Sunday, June 14th, between noon and 1:30. So definitely sign up for it if you're ready to make that change, especially in this environment.
And then I think you have a book.
Oh, yeah, sorry. I got so caught up on the workshop. Yes, I have my book, Ladynomics, A Woman's Prescription for Wealth and Financial Well-Being. You can find it on Amazon, but you can also find it through my my shopper's page, which is ladynomicsbook.com. And I also offer coaching programs, different coaching programs. So that's what I'm working on.
And Dr. Kelly, please share with us what you're working on, because I know you have Saturday. Is it Saturday that you're doing your workshop?
Yep, Saturday at 3 p.m. Eastern Standard Time. So I'm Dr. Kelly, by now, but I help high-performing women overcome past hurt to have a happy and healthy relationship. And the reason why I'm so passionate about that is because even though I was really successful as a doctor, but I found myself in a string of toxic relationships, and it all culminated when my engagement ended. I was about to get married and the engagement fell apart and I had to put my life back together. So I wrote this book, Bounce Back to a Better You, recovering from the disappointment of a failed relationship. And when you register for the workshop on Saturday, it comes with a free autographed copy of the book. But you can also get the book at my site, www.drkellysbook.com. And I also do coaching. I help you ladies to recover from your failed relationship so you can have a happy and healthy life.
Thank you so much. You guys don't want to miss either of these workshops. And also make sure you visit them. You saw their social media handles throughout this whole thing. Make sure you visit them, ask them further questions. They're more than happy to answer them.
Thank you all. This was so good and scary, but good.
Life is scary.
Listen, I am always happy to see you ladies. You do such a great job informing us, and everybody, they are all over. I think Dr. Renee and Dr. Kelly, you have a weekly COVID update that you
every
do together.
Friday.
Yes.
Mm-hmm.
And Dr. Randi, please check her out on Instagram. She has the most amazing, just little statements to get you through the day, get you to get your life right. And please check out that COVID money. Dr. Renee, thank you so much for hosting today.
You're welcome.
It was fantastic. You have all the right questions. I love it. So can you tell us what you are up to, where we can find you, and we're going to see you again on the summit, right?
Yes.
Tell us what's going on.
Yeah, so Saturday, 11 a.m. Central Standard Time, noon Eastern, I am going to be teaching my workshop, Live Stream Like a Pro. So if you want to look just as fabulous as we do here at the summit on your live streaming and your recorded videos, come check it out. And you can find me everywhere at Ask Dr. Renee. I am doing so many YouTube videos, I can't keep up. As a matter of fact, I did a Facebook Live right this week. I did 1 or 2 Facebook Lives, so you need to check it out. And then please check out our every Friday COVID updates. We're actually slowly trying to be a little bit happier with them. So this week, I don't know what we'll talk about this coming week, but you guys have to check it out. It's going to be awesome. But we've talked about dating in COVID, and we've talked about what else did we talk about? Oh, we had to talk about Black Lives Matter, of course, because of what's going on right now. So definitely, please check me out at Ask Dr. Renee, YouTube, Pinterest, Instagram, all of that good stuff. And she's been posting everything here, but literally I'm Ask Dr. Renee on all the platforms. So thank you guys for everything.
And thank you so much. Everybody, please go to SocaMomSummit.com. Check out everybody's page. Each person has a page that has all of their social media. It has all of their websites, and you get to learn a little bit more about each person. And it has links to their special sessions. If there is a free session that is happening at the same time as a paid session, please go to the paid session that you want to go to. The reason for that is, as you know, with the April Summit, everything was available afterwards. You can watch the April Summit today if you want to. So, but these special opportunities, they have a limited number of people, and some of them don't have a replay. So you don't have, a lot of chances to connect with these women in this way. So please check out those sessions, and we will see you soon at the SocaMom Summit. Thank you very much. Thank you very much, ladies, and we will see you.
Bye. Bye.